Hi everyone, this is Miss PNG Air Services Limited 2019, Helen Ipauki. My phone! Sorry, I said... I would choose to advocate for better mental health for all, men, women and children all alike. I think this is important in our country. I feel that this is important because mental illness is associated with high morbidity and disability, which raises the socio-economic burdens in our country. And I choose to focus on mental health for two additional reasons. Number one is that it's within the scope of my study as a medical student. And as an aspiring doctor, I would like to bring more awareness to mental health by way of, as I mentioned, awareness and outreach programs that improve the knowledge and education of mental health itself and making known the accessibility of help and where we can go to receive formal psychiatric help and how we can provide the help even if we don't have the means to. Patients with mental illness are often marginalized and receiving the least amount of care, attention and even resources, which often results in them relapsing into acute psychiatric disorders, and then it leads on to chronic deterioration of their illness, and it's really bad for them. Sadly, also this is very common in our country. It's also quite, it's not diagnosed well, and it results to significantly reduce or inadequately addressed issues in our country. Also, I choose to advocate for this for the second reason is that women especially are more predisposed to acquiring mental illnesses in comparison with men. And statistics by WHO show that women are more predisposed to mental disorders, depressive disorders, and also age-related psychiatric illnesses. And about 80% of 50 million people worldwide suffering from wars and famines and conflicts, disasters are women and children. In PNG, the image is similarly distressing, and there are too many of our women living with depression, anxiety, psychological distress, domestic and sexual violence, and other associated pressures with gender discrimination. Victims of rape and abuse are living with stigma and psychological stress that has even gone to the point of it being a norm in our society. And I would like to break that cycle to bring about more awareness to it. I would like to work with established psychiatric institutions and people in that specialty to bring about more awareness and help to provide victims of these issues, and also education for everyone, who just for our benefit to know, and so that we're able to help people and to help break the cycle. That's why I choose to advocate mental health.